Hello, I'm Terry Harper from Spa Medical in Macon, Georgia, and I have a newbie here. So this is Sierra, and she's never had any injectables done. So today, we're first going to start with her Botox. And so Sierra has expressed to me already her interest in getting rid of some of these little lines here, which is very typical, again, of this age. And also, she has a very strong muscle here. Can you frown? Yeah, ooh. It's a really strong muscle, so we're going to treat that as well. So after this Botox takes effect in 3 to 4 days, maybe even a week, she'll be very smooth here. The goal for the Botox for Sierra and for me and for you would be to maintain the ability to lift her eyebrows, because without the ability to lift your eyebrows like, yeah, in conversation, she really loses expression. Now this area between the brow and the middle where she does this, I'm totally fine for her to have no movement of that because we really don't show so much expression this way that we can't show in other areas. But if we can't lift our eyebrows, we immediately look what people think of as frozen or plastic or done. Those are the words that I hear all the time. So we're going to do a little bit of Botox across the forehead of Sierra, and then a little bit through this muscle group right in here. And the big thing is in this age group, again, I'm going to need to confirm with Sierra that she's not pregnant and she's not nursing a baby. Other than that, there are some diseases that she could have, which would be very unlikely, that would be a contraindication, meaning I'm not going to do the Botox on her. But again, typically this age group, the main thing we're looking for is pregnancy or nursing. The diseases I'm referring to are things like ALS and those type of things, very serious diseases. So, is there any chance in the world you could be pregnant or nursing a baby?
No.
Okay, so we are good to go. Okay, so the thing that I'm going to tell Sierra about after the treatment, before I do it, is that I don't want her to go home and lay on her side or flat for the next couple of hours. So it's going to take that long for the Botox just to stay right where I want it in that muscle. The other thing I like for my patients to do is animate that muscle. So afterwards, in that window of opportunity for about an hour, I'm going to ask her to contract the muscle, not using her hand, but doing this maybe 10 times. And that really helps diffuse the Botox throughout the muscle. Other than that, she can pretty much go along her merry way and do whatever she would be doing this time of the day. No heavy massage over the area, and no laying flat or on her side for just a couple of hours. Now, anytime a needle goes through your skin, there's a risk of bruising. And there are different factors that may increase that risk. Our first little prick's going to be right here in the center. And they would be things like taking Aleve, Motrin, Advil, Goody Powder, Excedrin, those type of drugs tend to slightly thin your blood and increase your risk of bruising. The two other things that typically I hear my patients say that they do is either take fish oil every day or drink red wine. Both of those things will act a lot like taking, of course, a baby aspirin or something like that. Okay, how you doing, Sierra?
Good.
Good. You have 2 pricks right over here. 1, 2. There you go. Now, Sierra will not see any effect from this for several days. On average, 3 to 4. I'm not shocked if it takes a week. And the literature says it can even take as long as 2 weeks. Sometimes people with really fair skin, like Sierra, or sensitive skin, will actually see a little bit of redness at the site of injection that may last just a few minutes. I'm not surprised by that at all, but should that occur, I would just alert her of that. Lift your eyebrows like a surprise. So we're just doing tiny little bits of Botox all along her upper brow just to help decrease the ability of this muscle to act so strong to fold her skin up on her forehead when she lifts her brow. But again, I want her to be able to retain the ability to lift the brow. My goal for someone like Sierra is for nobody to even realize that she's had Botox, because she still has very natural movements and can make facial expressions. The thing that we're doing, though, is keeping her from creating deeper crevices in the skin, either here or here, that as she ages would be more difficult to get rid of.